the very important points which have been mentioned by Mr. Tanka, Mr. Kaju, Mr. Memen. Also some really learning points. I'm surprised India being so organized, have a very disciplined army that government has not been able to kind of coordinate like how Pakistan has done, like as Senator Mushahid said. But with that, I'd like to bring our next guest, excuse me, Dr. Upendra Kaul, also famously known as Dr. U. Kaul. I see a lot of people know him as that. He's an Indian cardiologist and one of the pioneers of interventional cardiology in India. He's the chairman and dean academics and research at Batra Hospital and Medical Research Center in Delhi. Mr. Kaul has published over 450 medical papers and has won the Medtronic Award for the best scientific papers in 1983. He received the highest Indian award in medical category, Dr. B.C. Roy Award in 1999. The government of India awarded him the fourth highest civilian honor of Padma Shri in 2006 for his contributions to Indian medicine. So with that, welcome to the show, Dr. Kaul. Are you with us? Okay, perfect. So here is my question to you. There are approximately 1 million new COVID-19 cases in India every 3 days. On Friday alone, 400,000 new COVID infections and the death toll of 4,000 has been reported. Some experts think the number is an undercount and the real numbers are 5 to 10 times more. Hospitals across India are short on oxygen and critical care beds are scarce. Since you're based in Delhi, one death from COVID-19 is reported every 4 minutes in your state, as per Reuters. Given less than 2% of India's population is fully vaccinated against COVID, number one, do you believe India has enough capacity, skills, resources to handle the pandemic? Number two, as a doctor, what do you think went wrong and what can be done different to contain the pandemic? And finally, how long before you see the levels of infection start going down to a manageable level? Dr. Kaul.
Well, you very rightly quoted the figures. The numbers are increasing, scaringly. If I look at almost every family has got a few members who have been affected. My wife was admitted in the hospital. My two relations are being treated by me in the hospital. Two of them, my cousins, died in the last 48 hours. So that sums up the situation in the city of Delhi, where all of those are privileged people. They could come to the hospital. They had oximeters at home, and they had oxygen cylinders at home. So the situation is quite pathetic. But I would like to, I am in Delhi, but my heart is not in Delhi. My heart is always in Kashmir. And I had predicted this tsunami in Kashmir last year when COVID had just started. So what we did, and we know that, organizations like Rotary and Lions don't make any sense there. They don't know even the spellings of these big sounding organizations. So what we did, we decided to go from district to district. Starting in September, we first went to Kupwara and went to Matsil and did a camp there under COVID rules, distributed PPEs. We had taken it from our own, first few from our own money, and then, treated people, guided people, how they can prevent a heart attack. Our mission is to prevent a heart attack, especially in the COVID era. And then finally, we could get, because those areas, many of our esteemed people sitting here won't even visualize what is there. You might have heard about it. For 5 months, Matsil gets cut off from Kupwara because of bad weather. So what we decided that we need to do something for the people. So we got a tele-cardiology system put there. Indian Oil Corporation, from their social responsibility fund, through one of my patients and friends, Mr. Pathan, got it there. It is functional there. We have a relationship with the Indian Army there because it's only because, they can help. And now we are planning to have similar things in Pulwama district, Hall, my native village, one in Jagti, where, there is these Hindu migrants who had to unfortunately leave in 1990. There is a community there. So one for that. So that is one aspect of that, what we are doing. Number two, we found a foundation because, in the name of my mother, Gauri Kaul Foundation, which is looking after these people. We went from district to district. We went to Bandipur, Khan Sahab, we went to Banihal, and then also realized that a lot of bureaucratic things come in between. And so then we decided to go through Indian Army. And now what we have done, because there's no point of just having a look at the patients in the camps, where do they go? On 10th of April this year, we started a heart center in the heart of the city of Srinagar, Chanpura, called Gauri Heart Center, where we have kept all the non-invasive machines and with a modest, expense for the patients and the people who are coming from the camps. We don't charge anything. We give them medicines free of cost. We have appealed to many drug companies to, donate things. We are in collaboration with Ummeed Foundation, which I think Mr. Memon might be knowing, is from Maharashtra. Basically, it started for, when religious killings started there, and they started, organizing food, shelter, and other things for the, people who were suffering. So we are in collaboration with them, and I think we're asking for funds under the banner of Ummeed Foundation, because Gauri Kaul Foundation cannot take it for the next 3 years. So we're asking for donations so that we can reach to the people of Kashmir who have seen devastation after 5th of August 2019. Nobody talks about them. Nobody goes there. Roads are in a mess there. So I think, and COVID situation is worsening there, right? This morning I was talking to Dr. Khuru. He's one of the very well-known gastroenterologists there, and one of the forward-looking persons, that we're going to have at least 10,000 cases every day in the next few weeks in the state, in Kashmir, and 100 deaths. Right now, we have 30 to 40 deaths every day. So we have to do something tangible to help spread this. And still, I think we have to go from place to place, broadcast, go on loudspeakers, mics, not to come out from, the places like the backwaters of Dal. If you go there, there's a place called Moti Mahal there, and which is, totally neglected areas, where to teach them, tell them personally. I don't think we can go in with, government support. I think we have to handle these things at a personal human level. And that's what we're trying to do. We have now at least 100 people with us working for us for the Gauri Kaul Foundation. And we have decided to go. I go every 10 days, despite COVID. I go to Kashmir. I go to interior of the places, protect it, and try to teach them, try to tell them how to do. So that's my very small and humble contribution I'm doing. I'm too small to try to help Delhi and India and all that. I think if I can do something good for the place of my birth, I think I will do something. That's all I have to say.
Okay, Dr. Kaul, so thank you for your insight. Absolutely. I mean, it's actually staggering numbers. It's kind of pretty scary what's happening. And I do understand where you're coming from. We do not basically promote any individual organization. The reason we brought in, mention of Rotary International is because they have the logistical support, and they're pretty big. They have FCRA clearance, and they can reach out to remote parts of India, since they have large number of members in ground logistics to support them. But we also have people from within India and within the United States. They are welcome to reach out to either Rotary International, and we have, I believe, Tankasab, you can correct me, the South Asian president, Kamal Sangvi. Is he South Asian president, Tankasab? Sorry, you're on mute. You're on mute, Tankasab. And also we have Ejaz Rashid, who is the founder of Ummeed, who is also running an NGO.
Kamal Sangvi is the Rotary Director,
Rotary.
Rotary
Yes.
International Director of South Asia.
Okay. And we'd like to, I think, before we bring in, I'd just like quickly say that Mr. Sangvi and Mr. Rashid both operate NGOs, and they are both, of course, here to help us out, help people who want to help. And you feel free to reach out at between this. I'll probably type in the, if we can type in the, I'll type in the contacts for both Mr. Rashid and Mr. Sangvi here, and give them an opportunity to speak and kind of talk about their efforts. But prior to that, I would like to probably bring